Hi, my name is Frida Spencer, and the topic is abuse of the emergency room. Learning objectives. At the end of this presentation, the viewer will be able to identify reasons people abuse the ER or misuse it, discuss the impact of the ER misuse on nursing, discuss the impact of ER misuse on healthcare and society. Introduction. Abuse of the emergency room can come in many forms and happens for many different reasons. Another way of looking at it is improper use of the emergency room. This means people are coming to the emergency room for things they could have gone to their primary care provider for. People coming to the ER for socioeconomic issues, such as being homeless and needing somewhere warm to sleep, or drug-seeking behaviors. These are just a few reasons, however, that people misuse the emergency room. Reasons people use the emergency room inappropriately: lack of insurance, lack of knowledge, socioeconomic issues, lack of a primary care provider, and comorbidities. Heart in quotes. The complexity of HNHC or high-need, high-cost patients often extends beyond medical diagnoses to include community, behavioral, cultural, addiction, and socioeconomic challenges. Influence on nursing practice. Nurses caring for frequent ER users experience low morale, frustration, and a sense of failure. This ultimately leads to reduced quality of care for these patients and all patients in general. Impact on healthcare. Money is obviously the biggest factor here. In a study performed in 2010 in Texas in Houston and Harris County hospitals, it was found that 41% of the visits that year could have been managed at a PCP office, accounting for $5 billion in uncompensated care. Obviously, that is just a small percentage of this issue nationally because that was a very small sample that was taken. Emergency room utilization is being targeted as a cost-saving measure to reduce healthcare costs by government agencies. This will ultimately result in even more uncompensated care because these government agencies are targeting patients who are Medicare, Medicaid patients, and patients that are uninsured. Impact on society. Improper use of the ER results in overcrowding of the hospital's ERs, with frequent returning users as a contributing factor. This overcrowding ultimately leads to long wait times for patients who are using the ER service properly and typically need to be seen faster. An example of this would be a patient who is there because they need a warm place to sleep because it's cold outside and they don't have anywhere else to go. Taking up a bed for a patient who could have chest pain and needs to be seen fast, but there is no bed available for them. Additionally, the uncompensated care drives increases in costs for healthcare and all members of society. In summary, the most common abusers of the emergency room are people who suffer from socioeconomic issues such as homelessness or mental illness, and the uninsured or Medicare, Medicaid users. Improper use of the ER contributes to billions of dollars of uncompensated care per year. Improper use of the ER negatively affects patients, nurses, healthcare, and society as a whole. And here are my references.